webinar, and I raised my hand and volunteered last week. So I will just beg apologies here that the webinar was somewhat hastily put together, but hopefully the information will be helpful.
Definitely.
What I want to do today is first just a little background on our organization, the American Chemistry Council, and how we practice responsible care in the United States. And then I'm going to talk about a project which we initiated after some very high-profile incidents that occurred in the U.S. in 2019, and how we tried to capture lessons learned from those events to help our companies improve their emergency preparedness and response efforts. And then I've got a very short set of slides on a second topic, just looking at some of the occupational safety practices that are common to other responsible care programs around the world. Nothing that should surprise you, but focusing perhaps a little on the what I'll call the more people softer approach, softer items of occupational safety codes around communications and leadership. So let me start with the American Chemistry Council, the organization I work for. We are the primary trade association representing the chemical industry in the United States. We have more than 150 companies that belong to our organization. Many of them are well-known names, Dow, DuPont, BASF, others. We also have many smaller companies that belong to the American Chemistry Council. Now, small in the U.S. context is 500 employees or less. So obviously that's quite big in some parts of the world. But what we do have are some companies that even have fewer than 50 employees. So it's not just the largest chemical manufacturers in the country. Obviously, we're producing the products that make life better for people, and hopefully are solving some of the challenges facing the world today. Our primary activity is advocacy on behalf of our members in Washington, D.C., but also in our state capitals, and even sometimes working down to the municipal and city levels when there are issues that are of interest to our members. Responsible care was adopted in the U.S. by the American Chemistry Council in 1988. So next year, we celebrate our 35th year of responsible care. And our requirements for our companies are probably very familiar to you. We have a set of guiding principles that our CEOs sign when their organization joins the American Chemistry Council. We also have performance data that we collect from our companies each year, and then post that data on our public website. We have 3 codes covering product safety, process safety, and security. And we also have a responsible care management system that companies must demonstrate conformance to through third-party audits. And those, are the 4 or 5, I should say, kind of program requirements. There's obviously a lot of work that goes on behind each of these. One thing to note is that at American Chemistry Council, responsible care is an obligation of membership. If you want to join our organization, you must agree to participate and implement responsible care. And companies that join and then fail to meet the responsible care requirements can be removed from membership. So we take it very seriously. This is the same model that we see our friends in Canada use. And if few other countries have responsible care as an obligation. Just a little background on our codes. As I mentioned, we have 3 codes, which cover process safety, product safety, and security. Each of these codes was recently revised, and I'm getting some feedback here. If everybody could be on mute, that would be helpful. But the codes are written in a plan, do, check, act manner. They start with a strong commitment from leadership and go through till continual improvement. These codes have been in place for many years, and they complement our responsible care management system framework that we have. I mentioned that we have a third-party audit process. Companies demonstrate conformance to what we call the RC 14001 technical specification. It is a document that is a combination of the ISO 14001 standard and additional responsible care elements. And we expand the scope to cover occupational safety and health, security, and other activities that fall under responsible care. And just to give you an idea how this works, we have an excerpt from the document. This is the ISO language here for external communication. And the way we've expanded the scope is to add some additional text to the document so that instead of just looking at communications about the environmental management system, we're now looking at responsible care management system communications and make sure that that includes occupational health, safety, and security. And then there are unique elements around product safety and product stewardship that are included in that requirement. And this is all audited by third parties, and you get a certificate at the end of the process. And this, again, is a requirement for our companies. In the area of performance reporting, we collect a number of metrics or key performance indicators from our companies each year. They range from environmental through safety, and also some dealing with accountability as far as community outreach activities and emergency response initiatives. And we report these publicly on our website. So this is part of our commitment to transparency and openness. We have performance data there for our 150 members, but also for the 100 what we call responsible care partners that are in the transportation or storage area activities and support our companies and also participate in responsible care. They're not eligible members, but they can participate in our program. And just an example of how we share this information, we do this in the aggregate. So here's just a page from our website that shows GHG and emissions intensity numbers. This is all based on data collected from all of our member companies. And then if you were to go into the website, it also will allow you to see individual company data for some of the metrics. This one covers occupational safety and health. And as you can see, you can go in as a member of the public and see the data provided by each of our member companies. And it just lists them alphabetically. So that's all part of our responsible care program, the requirements, and how we report out. So let's move to the topics that I wanted to share today. Excuse me. And the first one, looking at this issue of emergency preparedness and response. If you go back a few years, in the state of Texas in 2019, there was a series of very high-profile incidents that occurred during a short period of time. This incident in the lower right-hand corner was in early April. It was a small facility, small company. They had an explosion on site, and several people were killed, a number of people injured. This larger incident here in the upper left was a tank farm fire that occurred also in April of 2019. This was one which caught the attention of the entire country as the facility fire went on for, I think, 11 days, and was visible, I think, even from space, when the astronauts could see it from the the International Space Station. This one down here in the lower left occurred in July. It was at a refinery outside of Houston, and nobody was hurt, just like nobody was hurt in this larger one at the tank farm. But obviously a very high profile event. And finally, this one in the upper right-hand corner took place in November of 2019. As you can see, the fire, but also this was one which featured explosions which caused columns, distillation columns, to be launched into the sky above the plant. Again, caught on video, of course, shown on social media and the regular media. And unfortunately, this event occurred in the Port Arthur, Texas area, and required the evacuation of 50,000 people right around our Thanksgiving holiday, which is one of the bigger holidays in the United States. Family travel, people travel from all over the country to be with their families. And you had 50,000 people who had their holiday spoiled because of this event. Obviously, not something that you want to occur at all. This, of course, led to a lot of questions in the media about the industry and its commitments to safety. This was, as I said, in Texas, where one assumes that the political leaders and others are familiar with the industry and perhaps would be at least be sympathetic to our concerns. But we found that because of a lot of change in the political structure there, especially in the Houston area, you had people who were not very familiar with our industry who had come into office recently, and we had not really built a lot of bridges to them at that time. So we were probably under a little more pressure than one would have expected after these incidents. We also had within the ACC membership, our CEOs were very concerned about this. They saw these events. They questioned why they were occurring. Several of these companies were part of our responsible care program, and they were asking how could this happen at a responsible care company. We had to remind them that just because you are a responsible care company, you're not somehow immune from events of these types. Things do happen, and ACC as an organization pledged to provide more information, more lessons learned to the membership in order to help them avoid these types of incidents in the future. Now, just a reminder that responsible care, this issue of emergency planning and response, has been part of the program since we first adopted it here in the United States. It was part of the original responsible care program in Canada, and we have continued for 35 years in the US to focus on emergency response efforts in our plants. Obviously companies have to engage in risk assessment and management of risks to support this. We've had over time well-established systems at our facilities to support response efforts. This is not an area where we found in the past resources are lacking, but again, these incidents shook up the industry, you might say, and caused us to have to step back and ask, is there more information? Are there more lessons learned that we can share, more tools we can develop so that companies can avoid these types of incidents? We also see in the US that there's good collaboration between local responders and companies. This has never been an issue in the past. And in many industrial areas, there are very robust mutual aid programs where companies are pledged to share emergency response resources to assist their neighboring facilities in the event of an incident. This is especially true in the Houston area, where 3 of these incidents occurred, where there is a well-established mutual aid program that involves hundreds of chemical, oil, chemical, and gas facilities, as well as other organizations that support the industry. So what did we learn from these incidents? Well, one of the first lessons learned was in the area of mutual aid. And we understand that companies, when they have an incident, rely on multiple sources of assistance. Obviously, there are your local municipal resources, your fire brigades, fire departments here in the U.S. That are trained to come out and assist in the event of an incident at a facility. We at ACC encourage our companies to bring emergency responders on site for tours, and also to collaborate on planning in the event of an incident, so people know what to do when they these mutual aid agreements between industry groups and neighboring facilities to provide resources. Some companies bring in contractors to assist in the event of an incident if it's for an extended period of time. What we learned during the incident was just, these incidents was, asking the question, are these folks still able to respond and willing to respond? Obviously, in the municipal and responders, they've got to, that's their job. But one of the questions you have do they have the training, the equipment, and able to come on site and assist you? Many times, information was shared, plans were written, agreements made many years ago. There's an assumption that everything is still as it was when an agreement was made for perhaps industrial support in the event of an incident. But what if that facility that you expect to bring a fire truck or bring other emergency equipment no longer has it, and your plan does not reflect that? What if they don't have the materials, the absorbents, the foam that you're expecting to show up in the event of an incident? So what we did was we tried to get the word out to our companies that you need to go back and look at those agreements that you may have with other industrial facilities for mutual aid, and make sure that the resources that you expect to arrive during an event are still there and available. Whether or not your municipal responders are still located where they were when you wrote the agreement. For instance, a fire brigade's location may have shifted because of just a need to move to a new facility. We found in some cases when talking to our companies that they have had incidents where they found out that because of budget cuts or just lack of personnel, some fire departments are shuttered on the weekend, and they have to rely on a fire department that is a little further away from the facility. So instead of taking 7 minutes to arrive, it may take 12 or 13 minutes to arrive. Those could be critical minutes in the event of an incident. So companies need to understand the changing landscape out there, and especially after the pandemic, when so many people decided to retire or leave their professions. We have to make sure that those resources are still there and available. We also found that especially with that incident that I mentioned that lasted 11 days, companies have a lot of good emergency response plans, but a lot of them are designed, or they kind of assume the quick resolution of an incident. Something happens by the end of the shift, everything has been taken care of. The fires are out. The injured have been moved out of the location and are in the hospital, and we can start to do the cleanup and investigation. What happens though if an incident lasts 2 days, 4 days, 6 days, or in the case of this tank farm fire, 11 days? Are your plans able to accommodate that type of situation? Do you have the personnel that are experienced in these types of incidents? Have you thought through what are some of the scenarios that might occur, especially as at that tank farm, a cascading event where one after the other tanks of chemicals started to catch on fire? What happens when the responders resources are stretched, so that perhaps you don't have the ability to bring in more people? And again, if you have mutual aid agreements with other facilities, what happens when those facilities start asking the question, well, we've got people over there fighting a fire now for several days, we need them back at our facilities. So these are kinds of questions that we started to ask our members to think about. Even simply, how do you make sure that people are fed, housed, etc., in the event of a long-term incident? Fortunately, in the case of that 11-day event, people were able to provide support throughout the 2-week period. However, again, resources were stretched in the Houston area, and we were fortunate that nothing else occurred during that 11-day period, because again, that would have required, a shifting of resources in the event of a second incident. And finally, we found that, especially with that fourth incident that I talked about, the one dealing with the fire in Port Arthur that caused evacuation of 50,000 people, in addition to the local community being evacuated, there were a number of chemical facilities that were located near that site that had the incident, and they had to either shelter in place with their people, or they had to evacuate those facilities on short notice and could not bring people in for several days to operate the facilities. This again raised questions about what type of planning are you doing, not for an incident that occurs on your property, but what happens with an incident that occurs on a facility that is adjacent to your property or nearby that can have an impact on your operations. So one of the lessons here was to start to go back and look at your emergency planning and plan, I should say, and consider off-site impacts. Whether an industrial neighbor's incident could cause disruptions in your facility. What are their worst case scenarios, and have you shared? Have they shared that with you? Have you shared your worst case scenario with your neighboring facilities, so that everybody understands what the potential is in case of an event? Also, are there transportation routes which may run adjacent to your facility, such as a rail line, a road, a pipeline? If they were to have some type of incident, or some kind of incident were to occur in the transportation route, could that have an impact on your facility, where you may have to again evacuate, shelter in place, or just have a situation where people cannot return or get to work, which could have a detrimental effect on your operation? So again, we asked our companies to say, let's take a look at our plans and make sure that we're taking these types of situations into account. So as a result of one, learning some of these lessons, collecting what we call examples of excellence or excellent examples from our companies around emergency response and planning and response, we put together a number of documents in 2020 for their use. Now, one was a emergency management guidebook. This was a fairly lengthy, I think 75, 80-page document, which tried to capture some of these lessons learned and also provide examples of emergency planning and response activities or examples from other companies. This is probably nothing that was so out of the ordinary for a lot of companies, but it was a good, I think, just reminder document, you might say, that companies could use to just in response, from some of these companies that have very, very good programs. We also developed a number of hazard identification and risk assessment tools focused on above ground storage tanks. Remember, that was that large 11-day event. We wanted to make sure that companies that have these tank farms on their sites are considering, a broad range of hazards and assessing risk. We found that a lot of companies, their plans may take into account a single tank perhaps catching on fire and burning. But again, what happens when you have a cascading event, where as we said, domino type event, where one after the other start to catch on fire, and you have multiple types of chemicals perhaps being released into the environment, and you're fighting the fire may become very difficult. So we also had a document, a checklist, you might say, that we put together, just listing some of these scenarios with offsite incidents and what kind of factors to take into account in your planning process. And we also put together a series of documents that we'll call EHS and S for security protocols that companies could use to review their commercial partners' environment, health, safety programs in order to determine whether we want to do business with you. So think of it as an assessment protocol that you could use to review, audit your commercial partners. Many companies have these already, but we decided that we would update the ones that we had for ACC, which we've made available in the past to our member companies for use. One other thing that we've done to kind of put some additional focus on this area of emergency response is that as part of our third-party audit program for RC 14001, we introduced what we're calling an area of emphasis initiative under the audit process. And this allows ACC to require our auditors to look at a specific area of the management system with a little more attention to detail during the course of their audits. And the idea here was to put some additional attention on emergency planning and response to determine whether or not some of the lessons learned from these 2019 events and the materials that we developed in 2020 and 2021 were being taken to heart by the companies. And this is a way for us to, assess whether that those messages have been, received and things have happened to improve in this area. So some of those lessons I talked about with reviewing your mutual aid agreements, focusing on offsite incidents, again, perhaps part of companies' initial plans already, but in case we needed some additional attention, this audit program, obviously if you need to, you have something here to show the auditors, that's important because people do want to pass their audits and get certified under our program. So let me stop there and see if there's any questions at this point about this first topic. Anything in the chat box? Are you still there?
So Daniel, may I ask a question?
Yes.
So thank you very much for your detailed presentation. I think lots of learning for all of us. One area that that American Chemistry Council, I think, how can you partner with the PCMA to develop a capacity of implementing these processes, the requirements of the RCMS 14,000 here in this part of the world? Is there any knowledgeable persons or the people yet or not yet?
Yes. Now, I'm not sure if you know, but I think we had some people from Pakistan attend a RC 14001 training course in Dubai several years ago. Here's the challenge. RC 14001 is available to any organization, regardless of whether you're an ACC company or not. Okay, so because we have the linkage with ISO 14001, we cannot restrict it only to our members. So we find that there are companies in the Middle East, in Saudi Arabia, in Qatar, and in Kuwait, others who are doing RC 14001. We have companies, several companies in India. We've got companies in Southeast Asia who are doing responsible care RC 14001. The only requirement is that the audits be conducted by auditing firms that are accredited, and those companies have to meet certain ACC criteria. Nothing spectacular as far as those criteria. It's ISO registrars who do that. Okay. The challenge, I think, for us, and I've had this conversation with Mr. Kadir, Mr. Tahir Kadir, who did some consulting for your organization years ago, was the accreditation body that we use, the ANSI National Accreditation Body Board, which is based here in the U.S. They do not accredit registrars in Pakistan, and I don't believe they allow their people to travel there. I'm not making any judgments here. I'm just saying this has been their policy. So for them to be able to allow their mark to be on a certificate issued there for RC 14001 it won't happen at this time. Now, if we wanted to work with you to find the equivalent body in Pakistan who could serve as the accreditation body for Pakistan-based ISO registrars, we could find hopefully some way of doing that. If PCMA wanted to create its own model, that would be fine as well. We could help share our process. What I would urge people to do is just consider, if there's a lot of competing models out there, it could create confusion. So, I've always said, we're willing to work with anybody, to help make sure that you have the tools to drive continual improvement. And I think we'd be happy to work with you on that. Hope that helps.
Okay, that helps definitely. The build-up question on this response is that there should be some kind of a training and development the people need to implement these processes in the respective organizations, as well as helping other organizations to build in their organization, a collaborative approach you mentioned in your slides as well. So are there any accredited or recommended training centers for the RC 14,000 by ACC, or there are any?
There are.
I'll preferably try to link in the Middle East region.
Sure. In the Middle East region, no. I had an inquiry from an organization out of Kuwait recently about how they might be able to do some type of training, and that was at the behest of one of their clients, and I said we would be willing to work with them on this, but it seems to have not come to fruition. There's not a lot of Middle East-based resources. We do have an auditing firm in the Middle East, TUV-ME, which is based in Abu Dhabi, which does RC 14,001 audits. We also collaborate with the GPCA, the Gulf Petrochemicals and Chemicals Association in Dubai. And one of my projects that I'm hoping to conduct next year is to get some type of workshop with GPCA for the region, simply because there are a lot of RC 14,001 users there. There's a lot of, perhaps opportunities for sharing of best practices around RC 14,001. And we may, from ACC's perspective, we may be able to, conduct one of our training sessions that we conduct on RC 14,001 for interested companies in the area.
Okay, thank you very much. And finally, just a small note that Pakistan is a very safe country. I think traveling to Pakistan should not be a problem at all.
I understand it. It's not me making that decision. It's I have the same problem. I've had the same problem with people who have said I can't travel to Colombia in South America. Yet I've been there 4 or 5 times and I've never felt unsafe. So it's just a matter of what your organization's risk tolerance is, I guess you might say. So,
thank you very much. Thanks.
Okay. Any other questions on the emergency response piece or anything about our responsible care program? And I'll be happy to follow up on anything with the PCMA staff on this. I got a question from Mr. Bassett.
Thank you very much. I think it was great, the first part of the talk. I think we can now proceed on to the second part, and at the end of that, we can again have questions, answer session. Anybody could ask questions from both topics. We can proceed with the second portion.
Okay, very good. I'm gonna just warn you, this is a very short section, and what I told Sana I would do is I would kind of look at some of the occupational safety and health practices in various global programs, and try to just talk a little about some practices that we find they're kind of common. I did not want to get into all of the kind of technical occupational safety and health activities, but I was looking to think about some of the as I said, softer areas around communications and other topics. But if we look at responsible care around the world today, it's pretty extensive. We've got I think 68 countries now that implement responsible care, and I've got a red line crossing through Asia, but I'm not sure why. But we've got, as you can see, all the countries in green are responsible care. We still got a big challenge ahead of us in Africa and Central Asia, but hopefully we'll be able to fill in those colors sooner rather than later. What we found is that, if you look back at the history of responsible care, employee safety has always been a key part of responsible care. I think everybody understands that our most important asset is our employees. They're the people who make our companies run, and we have to make sure, as we say, they leave work in the same condition as they arrived. Responsible care employee safety codes have been in existence since the Canadians first adopted the program back in 1985. We had a employee health and safety code as part of our original group of 6 codes that was adopted in the early 1990s. We found that over time, a lot of other organizations modeled their employee safety codes after ACC's original version. This is great. It shows that we were doing something correct. And we have seen over time that various associations have modified those codes. And last year, or actually last year, 3 years ago, before the pandemic, I was able to work with your neighbors in India on helping to revise their codes, and of course, employee health and safety being one of them. But there are other associations around the world that have, as I said, modified their codes over time to meet the public's expectations for safety. A number of associations have also integrated the concepts from that employee safety code into their larger management system framework. That's what we did in the United States. So we don't have an employee safety code anymore, but we've got occupational health and safety embedded in our RC 14001 management system. When I kind of look out over the width and breadth of responsible care world, I sometimes come back to the documents that were created by the Gulf Petrochemicals and Chemicals Association out of Dubai. They have an excellent series of documents covering their responsible care codes, very concise. I think they provide excellent examples for all of their codes on implementation. They have self-assessment questions that you can ask yourself, and they've also have information as to how the code elements link up with various management system models out there, ISO 14001, RC 14001, others. So if you have an opportunity to get into the GPCA website, I would encourage you to look at some of their responsible care code elements. You can also Google them, and they'll pop up on the internet. So I just wanted to focus in on a few kind of management practices that I think really lend themselves to getting attention, because we can be doing all the right things down at the plant level, but we do need to have some additional support. One of which is leadership. I think if we look at the whole responsible care effort, we need that top-down leadership from our CEOs and others. It is an area which I think as we in the ACC went through a revision process for our 3 codes in 2020 and 2021, the work groups made up of member company representatives focused with kind of a laser-like focus on leadership, understanding that we need to have that to drive responsible care excellence. Obviously, we want to have commitment from our CEOs. It has to be sustained commitment long term, but commitment can be words and not deeds sometimes. So, what we have kind of built into our codes is an expectation that beyond the words, beyond putting out an article in the company newsletter or making statements when they visit the plants about the importance of safety, there needs to be some tangible outcomes. So we've built in expectations that resources are provided to support programs, whether those be occupational safety or process safety or what have you, security programs. This is important because the resources are needed to make sure that people are receiving the tools they need, the training, building up their expertise, etc. We also have kind of looked at our codes again and said it's not just CEOs, but we have to put some expectations out there for plant managers so that they have a role in this as well. Participation and ownership at all levels of management for safety, whether that be occupational safety, process safety, or any other element of responsible care. And also that the leadership in the company have an active oversight role. It can't just be something where you're designating others to have that oversight, but there needs to be some accountability back to senior leadership. So that's why I think just looking at whether it be occupational safety, whether it be process safety, whether it be security or any other area of responsible care, the buck, as we say in the United States, stops here with the CEO and the executives who run the company, and there needs to be that kind of attention to this at that level. And sometimes if you don't have that, it's not going to fly in your organization. You're not going to have the kind of robust programs that you as practitioners are looking for. So again, I would focus attention on that leadership level. Yeah. Hello. Okay. The other kind of practice that I kind of zoomed in on, and there's a lot of this across the board in responsible care, employee safety codes, is this issue of employee engagement and involvement. We need to make sure that our employees are actively engaged in the development and implementation of our safety programs. They understand the hazards and risks of their activities and the areas where they work. We want to involve them in those activities as much as possible because again, they bring a level of knowledge to this process that perhaps managers and others may not appreciate at times, and perhaps it's that different perspective that can help to create situations where we're avoiding and mitigating risk. We also I think need to make sure that we recognize employees, whether they be individuals or teams of employees, for excellent work, safe practices, contributions that they've made to improving safety. Companies, I know many companies have awards that they have for their employees if they engage, if they provide helpful suggestions for improving working activities. So how does your company recognize people who do go above and beyond, whether it be occupational safety again or other areas of operations? And also we can't forget our contractors and others who are on our sites. They have views, they may have knowledge, they may bring ideas that can help, again, reduce risk and avoid, problems in the future. Many companies have contractors who are on site, full time. They may have the same level of understanding of the operations as your regular employees, and their views should be valued as well. So again, this area of employee engagement, employee empowerment, going again to areas where workers, do you give your workers the ability to shut down a production line if they feel there's unsafe conditions? We want to make sure that we send the message that we are trusting their judgment in these areas. So it's that area of employee engagement, I think, which is very important as part of making sure that your responsible care employee safety practices have buy-in and also are respected by your employees. The other one I'm going to just mention is communications. Again, you look across many employee safety codes out there in the responsible care world. They talk about communications. This goes back a little to the employee engagement part. How do you maintain effective dialogue and with your employees? And when I talk about dialogue, it's a two-way street. We want information flowing down to the employees, but we also hopefully will expect feedback and input coming back up based on what they hear. Obviously, you can be a very one-sided approach if you just think of communications as I'll constantly keep giving you information. But if you're not willing to accept, feedback and input, it can become very discouraging. Even things like suggestion boxes, if we're not, responding to some of those suggestions that may be put in there by an employee, the employees eventually realize, well, it's worthless putting in a suggestion, and you'll have an empty one as opposed to one that's full and people see as, hey, they're responding to me. We also, I think it's important to make sure that employees, contractors understand and are given information about the hazards and risks associated with their activities, and also kind of larger operations at the facility where relevant. We also see that really good programs have an expectation that you're going to share information about incidents and accidents between facilities in your organization. So if something happens at site A, you should have hopefully a process so that sites B, C, and D will be able to receive information about that event, and will be able to use that to avoid, say, a similar incident at their location. And again, sharing, but on a broader basis, how do you share incidents and accident information with other stakeholders outside your organization? Whether that be your peers at other companies, where they may be able to take those learnings and improve their own operations, or with other groups that may benefit from this information, that may be able to use it for a broader segment of the economy, where it could be lessons learned even for other industrial sectors. Are there processes for that? I mean, and are there organizations? Here in the United States, we have the Center for Chemical Process Safety, which does a lot of that work, but also there's opportunities to share information with your peers on a direct basis. At the ACC, we have a number of annual forums where companies can come together and actually share incident information and experiences so that others can learn from them. And we see that also with our neighbors in Canada, who have a very well-established process for doing that. And it has been very beneficial. So thinking about communications, not only within the company, but also how do you communicate information with your peers and others so that they can avoid those types of incidents. I'm going to stop there because I was told I had an hour. I think we run to an hour. I'm happy to answer any questions. And again, I apologize for this being somewhat short. Again, I really didn't have a lot of time to prepare, but hopefully this was worthwhile. Hello?
Daniel,
Sana, I think I'm finished.
so Daniel,
Yes.
are there any good practice documents the American Chemistry Council developed for contractor safety programs?
Yes, we've got a few documents. I can make those available to you.
If that is possible, then that will be a great help for us.
Yes, let me check and see what's there. I mean, we've got a few documents, but I will send those over.
And the second question that came to my mind was how the process safety code of ACC or RCC 14001 is different from OSHA's PSM.
Yes.
Are
Well,
these same things or are differences there?
Yeah, and I can share with you a copy of our code. But our code is written in such a way that I think.
So, sir, if you can mute yourself, then please, that will be a great help.
Yeah. The code is written to complement regulation. Okay, it's not there to replace it. What we tried to do with the code is the following. If you look at OSHA PSM in the United States, it covers certain types of activities within a plant. A company has the choice of let's just say it's a large facility. There may be sections of that facility that are covered by OSHA PSM regulations. You could, as a facility, just implement OSHA PSM at the, in the areas where, you have the regulatory requirement. Many companies decide, we're going to implement OSHA PSM everywhere in the plant, regardless of whether the regulation covers that activity. But we've also got many ACC facilities that are not covered by OSHA PSM just because of the nature of the operations. So the code is meant to provide, to fill that gap, you might say. And it also, I think, has additional requirements in there for leadership, for training of personnel. It does ask companies to, kind of take a holistic management systems approach to process safety. We've got the sharing of information piece that's part of our process safety code. So I will make copies of our codes available to the PCMA staff, and they can circulate those to others. But our code is written in such a way that if you're not covered by OSHA PSM, now you've got a process safety set of requirements. But it also looks at the broader organization so that it's not just the technical activities at the facility, but it's really looking at how are you establishing that culture of process safety excellence throughout the entire organization.
That's great. Thank you very much for the generosity and making the effort to make the codes available. Really appreciate that. in the same way, if you are feeling very good today and generous today, if it's possible that you can share your emergency protocol guidelines and good guidance.
I can do that. I will get you copies of those documents as well.
Great work. Thank you very much. So nice of you.
Any more questions from any other participant? If none, I think now you can conclude. Dr. Roczniak, thank you so much. It was a pleasure, and for you having you here, and especially and still, I want to thank you for getting up so early and joining us. And
It's great.
I'm sure the participants have benefited and experienced new ideas, and I'm hopeful that those would help them implement in their respective setups. And definitely this was a good experience for all of us. And the other thing is that it was a good experience, and we would like to continue having such sessions after mutually convenient, and whenever there is availability, we would like to have more sessions, because this was the first one. So I hope that in the future sessions there would be more questions to you and to the speakers, and this would help us a lot. Actually, we are at the PCMA, Pakistan Chemical Manufacturers Association. We have a long way to go in the standards that we have to put in place in our country and in our chemical sector. And I'm grateful for your help, and we will be looking forward for your continuous help. Thank you very much again on my behalf and on behalf of the PCMA and all the participants. Thank you, Doctor.
Thank you. It was a pleasure joining you today. I look forward to doing some work with you in the future. And it's time for me to go upstairs and make coffee for my wife, because we got to go to work.
Okay. Bye-bye. And
bye.
Okay. Have a good morning. Thank you.
Thank you.
Bye-bye.
Bye.